Okay, let's begin. Good afternoon, everyone. I would like to welcome you all here for this panel discussion on a topic which is both timely and significant in this modern era, that is masculinity evolved, navigating path to the mental well-being and authentic expression. It is very essential to acknowledge here that this discussion does not encourage any kind of gender discrimination. Rather, it fosters the empathy, open communication for the overall mental well-being of men. And by way of introduction, I'm Dr. Mohita Shrivastava. I'm a neuroscientist by profession. And I'm also the founder of the Cognitome program, which is meant for cognitive functions and cognitive skills training. And I would like to welcome my esteemed panelists, Dr. Otilia and Mr. Aamer Safdar, and I would ask them to introduce themselves and their area of expertise.
Hi there, I'm Otilia Gudana. I am a doctor in psychosomatic medicine, currently working in the field of forensic psychiatric, and I'm focused on bringing emotional intelligence in the therapeutic field. And also my main motivation is to reduce the physical aggression rates on a global level with the help of emotional intelligence.
Thank you, everybody. My name is Aamer Safdar. I'm a pharmacist of 28 years. I'm the last minute addition to this talk, and I'm a man. So we will talk about man, just me.
Okay, so my first question to Mr. Aamer and Dr. Otilia is that what do you think, what are the limitations that as a man you feel that poses hindrance in seeking the mental health support?
I think you should
start. So one of the biggest things, I'm a sufferer of mental health. I've been having issues in terms of stress and anxiety since 2021, and I'm on medication for that. This is really hard for me to talk about myself, but I will. So as a man, we often we don't consider mental health as a condition. We hide it, typically. We ignore it. We put it over there and say, it's over there. It's not happening to me. I did that myself, went through trauma for different reasons, and didn't seek help when I should have got help. And it wasn't too late, because you can never be too late, but I was suffering for more time than I could have suffered if I didn't think mental health to me was a taboo at the time. I can't go to my parents and say, Dad, I'm suffering from mental health, because my dad, as a South Asian man, wouldn't acknowledge what was really going on.
Dr. Otilia, would you like to speak?
So I think there are many limitations regarding these issues of mental health of men. I think the first important difference is quite basic, actually. It's anatomically. Men are built differently. They are genetically predisposed also differently. They are the providers and the protectors. The women are the nurturers, and they bring this emotional side to the equation. Definitely, you heard that quote, it's a man's word. It's also a song. But it's not just a man's word, but also the woman's word. We cannot disrupt or break down these gender roles if we can't see humans as one. So of course, genders play an important role in our lives and breaking down these aspects, but we are made of the same characters. The one limitation you also said is a stigma, it's a taboo which there is. I work, as I said, in a very aggressive and male-dominated field. And I asked my coworkers, who are mostly men, and I asked, how do you deal with mental health? And they said, what's that? We cannot do that. We just do. So they are programmed before birth, as I said, also genetically, to have these issues. So I think there's also a stigma part, which is also a limiting factor. Yeah.
And I would like to add here that apart from the stigma, there is a societal expectations as well as the concept of traditional masculinity. The societal expectations are, as Dr. Otilia has rightly mentioned, you need to be strong, the breadwinner of the family. A man is usually seen as the breadwinner of the family. The part of the emotion, being him emotionally vulnerable is not acceptable in the society. And the concept of traditional masculinity, as it has been defined in the literature, is basically consists of 3 traits, which are the power, hunger, and no femininity or domesticity, and being self-reliant. So these, the societal expectations as well as the concept of traditional masculinity, I think these concepts are the biggest limitations that imposes a challenge or stops a man to seek the mental health support. Right? Yeah. Also, if you can shed some light on what one can do to challenge the status quo for the concept of traditional masculinity, Aamer?
Say that again.
How do we challenge the status quo?
So the thing about challenging is it's not so much challenging. It's making people more aware of these things, because we all have different thresholds in terms of our mental health. We'll also have times when we're not very not well mentally, and then there's times when we're really well mentally. And the challenge for us is to make sure that our performance doesn't drop, our responsibilities within the family, within your workplace don't drop, and we are strong, or we see ourselves as strong. And I will talk about what we mean by strong later. So it's a different, as you said, we're wired differently. So because we're wired differently, we have different responsibilities. We've grown up in a different way. Because I'm the oldest in my family, I have responsibilities. And the woman will have different challenges, different expectations, but the man is, as you said, the one who brings the money, the one who does the work, typically, and the one who is the ultimate carer of the wife and the children and the family.
Dr. Otilia, what do you think? How can we challenge this concept of traditional masculinity? How can we change the concept?
I'm quite skeptical. I'm not sure that we can do something to it. Like the stepping stone of the psychotherapy is the motivation to do it, actually.
That's correct.
And if the men don't want to get help, it's quite difficult to force that on him, and it won't help. It won't work, actually. So I think it's important to educate. The psychoeducation is very important, and also emotionally support the men as a woman, as we as women. But I think it's quite difficult to say, hey, you need therapy, go to therapy. So you cannot force that on something, and it won't work.
That's true, and I personally believe it's just not about men, it's about an individual in general. If the person is not motivated enough to seek any mental health support or seek psychotherapy or psychoeducation, it is not going to work. But I personally believe that educating them and creating awareness about the mental health issues, about the psychosomatic issues that they encounter with, if not expressing their emotions, the suppressed emotions in an authentic way, it is going to not only overburden them psychologically but also physically, right? So we need to really educate the men in terms of creating, awareness, and we can have many awareness sessions, talks, workshops, and support groups, exclusively meant for the men's mental health support, and encourage them to take part and be open to communicate, right?
What do you believe?
Yeah, so what I was going to say is that the way I perceived my mental health, and I still perceive it in some respects, is that we're climbing a mountain. You can do all the courses you like. It will go in that ear, out that ear, because we won't be processing it. I'm just scared of that mountain. When I first realized, I was speaking to one of my friends, and he said, Aamer, you need to see somebody. You're really struggling. I didn't. I ignored it. I thought, I'm a man, I can get through this. And then the mountain, I was climbing up the mountain, metaphorically. I got up to the point of up on the mountain, and I looked down and I was really scared of a drop. Because, in my profession in the UK, I'm very well known as a pharmacist and other things. And there's shame of me not being able to climb the mountain. And it's just too difficult for me. That then opened up my emotions, and I cried. And I remember crying to my trainees who were early 20s. I'm 51 now. And I was embarrassed. I cried like a baby, twice. And they were very helpful, the trainees. It was their first day at work, so they didn't even know me. But the lesson that I learned from that is you've got to break down that mountain into small steps and then take it step at a time, and not to beat yourself up if you've gone back. Go back up again. But that's not easy. Very difficult.
May I interrupt? Thank you for saying that shame is so important in mental health. It's playing an important role, and also it's quite a problem in seeking help. There's still a lot of stigma, and it's considered a taboo, and especially for men, I believe.
I mean, with my therapy, I had counseling, I had psychodynamic psychotherapy, I was on medication, and I did that for about 18 months. And then in the end, by 2022, I'd said that, look, I think I'm ready now to come off work and go back into work. So I was off sick for 6 months and didn't work. And that shame, where I'm at home when I should be going out for work, was debilitating. It was really hard. Even though in the NHS in England, you get 6 months full pay. So I was getting my money, but the shame of me being not going to work was significant.
Aamer, do you think that being into a high leadership position also is a factor that imposes limitation to seek mental health support?
Yeah, I think the thing was that because when I opened up and put it out there on LinkedIn or Twitter or whatever it was, I was expecting a negative reaction, but actually it was the other way around. Lots of people came up to me and said, "Are you okay? Are you okay? What can we do for you? How can we help you?" And that then gave me some confidence in terms of, I am good. I can do these things. I've just lost the will to do those things because of my mental health. I'm too scared to take that step. So taking that first step was, as I said, it was hard already. But when you see your friends, when you see the messages you get, and you've opened up and they say you're courageous, I didn't think I was courageous, I was still scared. But I took that first step, found out that actually there's no people are supporting me, and that for me the stigma went. It took a bit of time, but the stigma went away because that's normal now. So now I talk to people, young people who have trauma, these sorts of things. I'm not trained for this, but I always say to them, take your time, I'm here, don't, if you fall over, pick yourself up, those sorts of things, to support them.
Mm-hmm. Dr. Otilia, what do you think? Are there some repercussions or cost that one might face if does not seek the mental health support? Being a psychiatrist, I'm asking you this question.
I believe everything comes from childhood. So, of course, it's important to weigh in that factor from the childhood on when the parents observe some problems. Intergenerational studies have shown that not dealing with these emotions can develop a heightened aggressivity rates and aggression, which is already a complete manifestation, I would say, of these problems. This is just one part, and it's not affecting only men.
It is affecting the whole family.
Definitely is breaking up relations as well.
Yeah.
And also can just break lives.
Yeah, that's true. That's true.
Leading to suicide.
Suicidal tendencies.
Yeah, definitely.
Aggression. Behavioral.
This is only one extreme of it.
Yeah.
But of course, there are lighter sides to provide.
Yeah, so what we're going to have in the next few years is a tsunami of mental health across the world, I think. I used to be a trustee for a school in England, and we found lots and lots of students during the pandemic years who they didn't have their friends, they were working from home, they didn't have that socialization, and we realized that they are traumatized at the age of sort of 10, 11, they're traumatized. These people, if they don't get that support and intervention, these people will carry that trauma with them. And it's every school child probably in the world, because I think in the pandemic years, nobody went to school. They didn't form relationships with their friends because their friends were all online. It's not the same. They're not playing in the playground. So we have to be very careful in terms of how we manage that. It's going to be a decade or more, I think, for to us to steady the ship and cover people. Certainly in my country, in England, the National Health Service cannot cope with a tsunami of mental health. We just don't have the infrastructure to do that.
I have personally seen in the clinical part of my work a tendency and higher cases, and the severity of cases has been post-pandemically shown. So there are repercussions. As you said, it's like trauma, substance abuse, social isolation.
Yeah.
Aggression comes.
Definitely, it's a very complex factor, which are definitely interconnected as well. Yeah.
So, as there are repercussions of not seeking the mental health support, so are the benefits of seeking the mental health support. I'm just going to shed a light on this a bit. So, what are the authentic ways a man can express his emotions, his suppressed emotions, apart from dwelling into the habit of substance abuse or alcoholism or aggression or irritability. So one way is to vent out the emotions in a cathartic way. Catharsis is a process of a powerful emotional release that, if successful, leads to very positive cognitive insights and positive experiences in life. How can we vent out our emotion cathartically? We can learn music, we can learn some new sports, we can retrain our brain by improvising our cognitive functions, cognitive control, mental flexibility, as well as, mindfulness-based practices, like various sort of meditations are there, brainwave entrainment processes are there. You can learn to balance your hemispheric, lateralization, and you can learn to play an instrument. One can learn to learn a new sports, cooking, anything that is creative, that enhances or nurtures your creative intelligence as well as emotional intelligence. So this is one way, catharsis. Second way is definitely to seek guidance and counseling support, or seek the psychotherapy. Basically, there are multiple ways to seek the psychotherapies, psychoanalytic therapies, there are cognitive CBTs, there are cognitive behavioral therapies, there are REBTs there. So EMDR is there. There's so many things that one can go through and seek the support to release the suppressed emotions in a therapeutic manner. So in any case, it is essential to release or vent out your pent-up emotions, which are not only creating a havoc in your psychological health, behavioral issues, but also creating long-term psychosomatic issues, which are manifested later in life as arthritis, chronic pain, psychosomatic illnesses, terminal illnesses, which might turn into cancer, all those things. So I really recommend everyone that be open, be communicative, and understand, foster empathy, enrich your emotional intelligence, and seek mental health support, not only for your own mental well-being, but for your family, for your kids, for your profession, for your work, and for your overall well-being.
See, what you've said has scared me, because you've given me a list of things that I should be responsible for. And if I was still in my mental health place, I would be terrified. And I wouldn't take the first step. I'm being honest here. I wouldn't take the first step because it's too frightening, because you've just given me a mountain to climb again. And that's the thing.
It was quite overwhelming to hear this list, but I think it's you can see it as a list of skill sets which can help you. I think this is a multidisciplinary approach,
Yeah.
and you can seek out which is helpful for you or for anyone else. It's not like it's a to-do list. One should work on, just really seek out what's helping. For my personal experience, meditation helps me, sport helps me, maybe doing some creative work won't help me.
Creating art.
That's not me, everybody should just seek
That's
benefiting.
A way to vent out cathartically, and the other way is to seek the psychotherapy, as I mentioned. The talk therapy, the counseling and guidance sessions. So, see, as both of you have rightly mentioned here, that not necessary that every approach or everything works for you. As like meditation, for example, meditation. We are into a lot of mindfulness-based practices here nowadays. That everybody is going to be, everybody is saying go and do some meditation, breathing exercises, and all that stuff. That's fine to an extent. But, as a neuroscientist, I would like to tell one very important thing here, that we all are aware with the concept of the brain waves. So a person who is over anxious or suffering from any kind of anxiety disorder, meditation works wonders. But a person who is already depressed, or a patient of MDD, major depressive disorder, meditation really doesn't help much. Right? Because there is an alteration of the imbalance of the brain waves. So we need to balance that. So as Dr. Otilia, as a psychiatrist, she rightly mentioned that every therapy or every approach is not suitable for everyone. But still we encourage everybody to at least talk to the relevant people to whom they trust, just not suppress their emotions.
I agree. I would add, of course, medication is one aspect to it. It also, on this list, we can grab and hold on to when we seek help. Medication, it's working when someone is having acute phases or just don't want to deal right now with maybe the therapeutic process, which they mentioned already. It's not a quick fix. You really have to do the work. You really have to work on that. So medication and complementary, then adding another aspects or layers of therapy, whatever that may be.
Yeah.
I think it's helpful.
Yeah, it's helpful. And so let's discuss some more approaches that helps in navigating the path to mental well-being in a masculine context now. Right? I think I would like to add here about the self-reflection, the self-awareness. One should reflect their own emotions, feelings, and thoughts periodically and understand what is wrong. Why am I being so irritable these days? What is that is bothering me? If you are self-aware, you're self-reflecting, that would definitely triggers, and if you understand your needs, that what are the trigger factors, that is why it is happening to me nowadays. I was not like this before, you know. So that self-reflection is very important point from a man's perspective. And second point I would really like to emphasize here is about being open to communication in a very honest manner, and of course with the right person, not to everyone that I'm having this, I'm having that. So better to go to a professional, or look for in the internet. There are many support groups you can join, you can share your stories, or you can read some articles that why is it happening, educate your own self. Be open to communication. Creative writing is one of the things which helps. You can share your story on the social media these days, you know, you can share whatever you're going through. Join the support group, seek the psychotherapy. This will also help. And third most important point is how to navigate this path of mental well-being is, you know, you can really go for the relaxation techniques. Like, as I mentioned, there are meditation-based practices, and there are some kind of, you know, creative tools and techniques that helps to foster the creative intelligence, and also go for the emotional intelligence classes. You know, that also help to understand your imbalance of emotions in you, and how to express them in a genuine, open manner. So I really would encourage you to be open to communication and seek support, because it is not going to help only you, but it is definitely going to help your family and your you know, colleagues and friends and family. Aamer, would you like to add on to this?
No, I think that's really good advice. And it's again like that, taking a horse to water and get the horse to drink the water. I think it's a great, but it's still, if you're terrified, you're still terrified. The stigma of taking medication for some people, and I'm a pharmacist, I shouldn't see taking medications as a stigma. That's my professional life for 28 years, but I did when I first took my citalopram, you know, and then it was quite funny, which broke the cycle. Was that my brother's on say medication, and he got constipation. So he was telling me that when you take this medication for the first few weeks, you might get lots of constipation. I didn't get constipation, I got diarrhea. And it was one of those diarrheas when you only have like 30 seconds to get to the toilet type diarrhea. And then that made me think that different people react differently to the medication, and it takes a bit of time for it to work. You start on a slow dose and you go up. I knew all of this. Professionally, I knew all of this, obviously. But as a person, as a human, I did know about it, but it's still a stigma for me. I'm taking the tablets. Now, I take them as routine. You know, it's not stigma anymore. I just take it, that's it, job done. And I tell people that I take it because there's no stigma for me anymore.
At last, but not the least, I would also like to end this session by saying one very important point, that regular monitoring of your mental well-being by evidence-based self-assessment as recommended by a therapist on a regular basis would really help you reflect on what is going through in your mind. For example, if you're in a bout of anxiety, you're bout of overstressed or something, and that would definitely help you to seek the support on time. Okay, and I would like to welcome the questions from the audience, if anybody would, yeah, please.
Hi, I'm Dr. Trishala Chopra. So this topic was extremely important because it's not discussed. And I come from India, and India is a place where this topic is definitely not brought up because there's a lot of male ego that comes before seeking help and understanding. So being a lifestyle medicine practitioner, what I face on everyday basis is my consultation with a male is very quick as compared to doing it with a female. So men are not very open. So whatever suggestions you shared, I felt that they work as distraction for a while, but when people are actually coming back to reality, the things are just there the way it is.
Yes.
So I have seen my patients benefit a lot from NLP, the neuro-linguistic programming, and the hypnotherapy. So my question is that the hypnotherapist that I normally refer to says that this therapy might not be very effective for somebody who's already on benzodiazepines or SSRI. So I wanted to understand from the panelists that how effective are these therapies when somebody is already taking drug support, and I have seen a lot of side effects coming from the drugs. So the benzodiazepine itself gives you depression, it gives you anxiety. So sometimes it worsens for many people, and they're in permanent denial that there's no help available. So what has your experience been with patients who are taking the drug therapy, especially on the benzodiazepines, and how do they normally respond to these alternative methods for actually understanding what's going on with them? Thank you.
Sure, I would like to take your question, and I would like to share an experience with one of my clients who was suffering from chronic anxiety from past 20 years. And he was on a dose of SNRI, 225 mg per day. Severe anxiety patient, but what happened, the situation has started that he was an anxious individual, the medications have been prescribed to him, and since grade 10 he has been taking those medications. But when he came to me, he was really into bouts of crying. Apart from anxiety, the depression has stepped in to him. So, of course, the counseling sessions helped and all those things have helped, but there was a structured protocol which involved all the kind of holistic training, including the cognitive functions. So what was happening, I cannot ask anybody to stop the medication without, the recommendation of the doctor or the GP he or she is going to. But I educated him. I motivated him just to try if he can reduce a dose a bit and see how it works. Or just 1 or 2 days, if you don't take a dose, what happens? What are the physiological symptoms that you are actually encountering with, right? But the point is this here, we should actually have a balance of both. We should have balance of the medication is, if somebody really needs a medication, we cannot ask to stop the medication, right? But eventually the aim should be, we should be drug-free, right? So this guy eventually has reduced his dose, and in a span of 9 months, he's confident enough. His, the scale of the cognitive functions, when he joined with those drugs and everything, it was 321 out of 800. And when he left the program, in the span of 6 months, it was 671 out of 800. His dose was really reduced because he was being educated. He himself reduced it, and with the seeking of the consultation of his doctor, his psychiatrist, and it worked miraculously for him. And it's, as Dr. Otilia rightly said, that it has to have its own motivation to succeed. These talk therapies and everything will definitely work. At least you need to initiate something. You need to tell them the sense of right or wrong. What is wrong in you and how do you need to navigate this path, right? So it works both the ways. First of all, what is required is the motivation to succeed. If somebody thinks that I want to get rid of the medicines and I want to live my life, medicine-free life, then it's his own free will and its own willingness to work in that direction. So I won't say that the drugs are definitely are really going to hamper something, but I think that there should have a there should have been a stepwise process to, and our main goal and motive should be to have a drug-free life.
Can I just come back to that? Sorry.
Sure.
It's just because I tried it. I'm a pharmacist. As a pharmacist, I would be saying to my patients, you've got to take these every single day. And what we do, I studied this in 1999 when I did my MSc around patients' belief of medicines. So I'm an expert with a small e in terms of patients and how they take their medicines in terms of concordance and compliance and adherence. And I didn't do that. I experimented as a pharmacist, which I should never have done. I didn't take medication for one day, for example, and I slept for 12 hours. And I put that down to my stress and me not taking my medication. And then I get more stressed when I don't take it. So I did go to the doctor, to the GP, and the GP said, we're going to up the dose from 20 milligrams to 30 milligrams. I'm now on 30. And they said, don't come off it until I've spoken to the doctor and we'll have a phased drop down. Because I've been on it for over 2 years now. So I can't just stop. I'm too scared to stop. Therefore, I'm addicted, if that makes sense. And that has another aspect of men's health. When you're addicted to your medication and you can't come off it because there's going to be negative things that come out of it. So it's your mind, even if you're not well enough, your mind is putting all these things into your brain and saying, actually, you can't take these medicines off because you need them. Then you become dependent. You see, so it's a really fine line. But you have to go to, I've had the conversation with the GP. I'm too scared to have the conversation with the GP to come off the medicines just yet, for a variety of different reasons. But at some point I need to stop. And I'm on this stage saying, well, I don't know what it's going to be like. And that terrifies me.
Quite a loaded question. I truly believe that regarding medicine, regarding psychotherapy or any other therapy included, there's an individual, the plan must be individualized for the patients. We cannot say everyone should take medicine or in this dose on which dose, and after 3-6 months we should just stop the medication or even prophylactically give it to them for 2-3 years. Of course there are guidelines and we respect them, but the main goal, and I think the main goal is that the patient is doing well and he or she is feeling good in his skin, and it's not harmful to him. He's not disruptive or correct. So I think medication is one part of it, but also pro-socially adapt this patient and rehabilitate into his everyday life. It's very critical, yeah.
Any other question?
Hi, thank you. I'm Dr. David Lee. I'm a clinical psychologist, also a certified addiction recovery coach as well, based here in Dubai from the UK. First of all, I just want to say I really like the title, Masculinity Evolved, and I particularly like that you put authentic expression in there. One of the things I wanted to pick up on is a lot of what you were talking about, Aamer, about your own sort of journey, and as a healthcare professional yourself, and I'm a healthcare professional who also believes in the power of speaking out authentically about a recovery journey, whatever that be from, whether it's depression, whether it's an anxiety disorder, whether it's addiction. My own journey is personal recovery from addiction and alcoholism, but I'm also a mental health professional. What I'm really interested in is how we can sort of change stigma in society. My own belief around that is that the more anti-stigma campaigns that we're having, it isn't helpful. What we need to do is create a culture of people who will talk openly and are willing to be a face and a voice for recovery. And I really want to thank you. A lot of gratitude for you doing that, yourself in your profession. I think I experienced the same sort of initial sort of reluctance to sort of speak out, and now I've found myself in a place where I'm willing to do so, and I feel the need to do so. My question really is around how do we take that further in society, and what are your thoughts around how we can start to empower men, if you like, to speak openly about their recovery and their journey, their mental health journey?
So thank you for that. I've done that. I'm on that journey in that I've written a few blogs for my profession, which are on LinkedIn. Anybody can join onto my LinkedIn. And they have picked up good traction. I've had people come, direct messaging me, and thank you for writing this blog. They've given their, and somebody who's quite high profile within my profession, if you've got this and you're struggling with it, well, that's okay for me to be struggling with it as well. It's not taboo anymore. I've spoken at a conference a few weeks back, similar to this, but I was walking around, and I've made it my mission for the next few years. I work with a charity, and I've written blogs for them, and I speak on behalf of them in terms of mental health, particularly young people, and do what I can in the time that I have to help people. And that's just my character. But that then means that we are beginning to normalize it. It's not so much of a taboo. Because if somebody with my prominence within the profession is openly talking about, like what I've done just now, that makes it easier for them. They can go to their parents and say, Mum, Dad, I'm really struggling here. And it's the taboo will then be less in terms of impact, I think. And that's what I'm trying to do as best I can. Because personal stories of individuals who sort of end up with a positive outcome is really, 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 really important. Because it shows people that you can be down in the dumps and really upset, but there is a way up. Whatever technique we use, there is a way up, and you will get there. And it might take more time. You might need some help. Come to me, come to anybody else. We'll give you positive vibes. We'll have conversations. And then if I don't hear from you, that's a positive outcome. That's what I say to my people who reach out to me.
Just in a short addition, I would like to add that definitely spreading awareness is one thing, but it would be crucial to attract the authorities, companies, and organizations to take a step and really just disrupt the rules or the norms, different cultures or societies. What do I have? It's a cultural, it's a quite complex thing, I would say, and we need the help of everyone included here.
It's still seen a taboo. I left my job because my manager at the time bullied me, even though I had mental health, and even when I was going through disciplinary, I said, this is mental health, this is not capability. But then in the end I left because she wasn't listening, and I went somewhere else. And that's the taboo that we need to break, particularly I work in England, in the National Health Service. It's toxic. We all know it's toxic, but we need to be able to do something about it. And I'm not going to do it by myself. I've got no intention of doing that. There are other bigger people who can do these things. But writing stuff down doesn't come with action. The action has to come from the top. Thank you.
So, any other question? Yeah.
Yes, one more question.
Yes, this is Dr. Ramiz. My question is about the difference between psychologists and psychiatrists. The most common difference is giving medication. People know that, at least known to people. Psychiatrists give medications, psychologists don't. So the question is, who should go to a psychologist and who should go to a psychiatric? Second question, are they completing each other or they are competing? Does everyone try to take the market from the other profession, or let's say someone goes to a psychologist and then they find there's no way to complete the trying to correct the behavior and then gets referred to a psychiatrist? So are they referring to each other in order to help the public, or they are trying to keep their markets? And again, who should go here and there if someone has a problem?
Would you like to take this question? Yeah.
Sorry, could you repeat the question? Sorry, because you said a lot, so if you could just break it up into...
If I have a problem, okay? I don't know how to diagnose the problem.
May you please speak a bit louder?
Yeah.
Who should go to a psychologist and who should go to a psychiatrist?
The people with psychosis should definitely go to see a psychiatrist, but in addition, they have also the therapist as well. It's like really multidisciplinary work, but it's important to say that you have an issue or someone has an issue. If that's just the general medicine or the general doctor, it's important to say someone. But the one with psychosis, go to the psychiatrist, definitely.
Yeah, I would like to add here is that people suffering from psychotic disorders, there is a criteria defined by DSM-5, Diagnostic Statistical Manual of Diseases. So there are different kind of disorders defined. A psychologist basically does the psychotherapy. Psychotherapy includes the talk therapy. Most of them are talk therapy, guidance and counseling sessions. And there are multiple ways of doing the psychotherapy like CBT, REBT, cognitive, the emotional therapies, so many things, EMDR and all those things. So they are generally the talk therapies. They will guide you, encourage you, and show a way and vent out your suppressed emotions. But the psychiatrist, on the other hand, is a person who, he's a medical doctor who is going to give you the prescribed medication on the serious issues like bipolar, MDD, schizophrenia, all those disorders which are not going to be tackled only merely by talking or seeking the psychotherapy.
So basically psychologists work on behaviors?
Sorry?
Can we say psychologists work on behaviors?
Yeah, psychologists for the behavior, your anxiety, your stress, day related to behavioral issues, or anything that is creating, trouble and giving you trouble, you're not able to think clearly. So you can go to a psychologist to seek the support, even in general ways. Need not to that you have to have some anxiety disorder defined or depression defined. In day-to-day lives also, you can go to a psychologist and seek the guidance and counseling sessions. Maybe it's family stress, maybe it's work-related stress, maybe it's just a time period that you're going through. So you need that support. But psychiatrist is definitely going to, he or she is a medical doctor and he treats the patient, the psychotic patients, the patients with the psychosis. As I mentioned, schizophrenia, bipolar disorders, serious mental health issues.
Sorry, it's very important to understand the severity of the issue. Like, just for an example, if someone is seeing dolphins in the air, that's a serious sign of psychosis, right? Then you should definitely should be seen by a psychiatrist, not only to get the medication prescribed, but also conclude some diagnosis, because also the organic medical issues can provoke these mental health issues.
Thank you.
I hope I made that clear.
Thank you very much, panelists. That was very nice, and thank you for sharing your personal experience. Aamer, would you say that this new generation, Generation Z, is very much more able to communicate authentically and express themselves? The 17 to 20, I guess the oldest Gen Z right now is 24. Would you say that this generation is more open to communicating and expressing authentically their feelings, and the masculine Gen Zs?
I'm not so sure because...
Well, maybe we can open it up to the audience. The doctors, Dr. David, Dr. Lee, is it? Yes, I believe you were saying that you work here in addiction. So would you, I don't know if you work with Gen Zs, but would you say that they're more in touch with their feelings and more apt at expressing themselves? The men, the boys, the 17 to 24s.
The boys of Gen Z we're talking about here.
Yeah.
I'll give you my personal experience of that. How do we find Gen Z born, did you say 24? So you're talking about
Currently,
anybody...
the oldest Gen Z is 24, yeah, about.
The oldest Gen Z is 24.
The oldest
okay.
Gen Z. The youngest would be 14, yeah.
Okay, so I will speak here as a clinical psychologist who does work with adolescents. I don't work with young children, but I work with adolescents and I work with young adults. I'm also a father of a teenage boy as well. So my own experience of that is that, have we made progress in terms of young men, or male adolescents being able to talk openly about their feelings? my own experience of that is that, well, society's changed. You know, we now live in a technological, digital society that's only getting progressively more. We're moving towards AI, everything. Is that going to help us to be more emotionally intelligent and articulate? I don't believe so if we just hide behind technology. I believe there's a way in, and I believe that for boys and males that has to be culture appropriate. You know, there has to be a way in around interests, whether that is you know, it doesn't need to be sport. I'm speaking very stereotypically here, but we have to think about the way society's progressing. Do I believe that you know, boys and young men are all of a sudden talking openly about their feelings with each other? No, I don't believe so. But I think there is a way in, and I think, for example, there's a wave of you know, sporting celebrities and athletes who have talked openly about their recovery, for example, from mental health problems and addictions and things like that. I think that's a way in. If boys can look up to role models who will talk openly about their suffering from depression, anxiety, addiction, trauma, whatever it is, that what we do is we create a wave there where people feel more comfortable to not be judged or stereotyped for having had those difficulties. But it has to be a cultural change. It has to be a societal thing. Yeah, you create waves. You can only, you know, create tidal waves from ripples, I believe.
Thank you. Thank you very much, panelists, for sharing your insights with us. That was thought-provoking. Thank you. Let's give them a round of applause.